just to pick up on some of the questions that you had earlier. So the issues that we discussed with the modeling yesterday was to ensure that the models were adjusted for the great work that every citizen is making in doing the mitigation efforts, and to see if that was reflected in the request specifically for ventilators. And so we wanted to make sure that with a limited number of ventilators and the issues that we saw in Detroit and Dearborn, in Cook County, and now in New Orleans, that we were balancing and projecting correctly based on both what the models had predicted and then whether they were adjusted for the incredible mitigation work ongoing in New York City. We understand that this week and next week will not reflect that mitigation, whether it's New Orleans or whether it's New York and the New York metro area. We know that the hospital admissions that we are seeing this week and next week will be infections that occurred before the mitigation started. But we wanted to make sure going forward that the needs reflected that. That was what was adjusted in the Ferguson model for the UK, and I know you're following that very carefully. They believe strongly that the mitigation methods that were put into place that informed our mitigation methods, we all were working off of that same model, and I want to make it clear that those models, those flu models, have been incredibly helpful to really predict what would layering of these different mitigation methods, from social distancing to staying home if you're sick, to staying in that household, to quarantine everybody in the household if anyone is positive. Now, there are other countries that took different approaches, and I want to be clear because we did hear from both China and South Korea. But it's always important that you adopt and adapt it to your community and the reality of your country. We do this around the world. You can't ever just take an off-the-shelf approach and then put it into action in your community. You have to understand your communities. And so although both China and South Korea removed people who were positive from their households and segregated them away from their families, we did not think that our Americans would adopt and adapt to that situation. And so that's why in our guidelines we asked people, if there is a family member, to try to self-isolate in the household, and so that that person is still there in the household. So I just wanted to be clear that, yes, we all heard about what China and South Korea did. As much as we could, we adapted them to the American situation, as the UK has done also. And we just wanted to be really ensured that all of the requests for the stockpile reflected the great work that the American citizens were doing in each of these areas to ensure health. And then finally, I know there was a question about requiring quarantine. I want to make sure that everyone understood when we talked about New York residents who had gone to other places, it was for them to voluntarily self-isolate and take care of themselves because we felt like they could be exposed, and we really wanted to alert them that the rates in New York City were high and were increasing, and that they were probably exposed during some of the most exposure time period before the mitigation efforts went in. So this was really about a health of our New York citizens that then chose to go to other places, both to protect themselves and to protect others. So hopefully that's clear to everyone about those issues. We continue to look at the data every day. We really want to applaud the laboratory testing that is helping us. It will help us very much when we can get full surveillance up in many of our communities and surveillance around those most vulnerable, particularly in nursing homes and long-term care facilities, so that we can more rapidly test both the workers and the occupants in those communities. Thank you.